From my perspective as a physician, helps with turnover times in the lab.
So we'll start with, how do you take your coffee?
So I like cappuccino and oat milk and some sugar-free hazelnut or caramel or something, like a low sweet.
Just one or two?
One, just a little bit,
Many
just
doctors
a
I
little
know
bit.
put way too much sugar.
Oh no, just a little bit, and sugar-free.
Okay.
Yeah, I guess that's better.
What are the top 3 emojis that you use the most?
The laughing emoji, yeah, and the tongue emoji, because the silly one, and the wink one.
Okay. What's your favorite sports?
I'm a big soccer guy. Grew up playing soccer. I was captain of my soccer team at school, and just I'm big into soccer.
How did you decide on electrophysiology?
Ooh, that's a tough question, but I've always wanted a specialty that kind of like links, physiology with kind of procedures, and just EP is one of those rare specialties where you can do procedures, but also really links well to physiology and anatomy and all that stuff. So I felt like surgery is like a lot of mechanical thinking, but EP there's a lot of like cerebral kind of thinking to it. So kind of a nerd who wants to do procedures. So that's how it kind of ended up becoming EP. And then some of the fastest growing specialties. There's so much technology involved. Probably one of the biggest specialties with lots of like high-tech technology in it, whether that's hardware or software. So it kind of like really up my alley. So yeah.
We've gotten to do film procedures, and I would agree that it seems like there's more bells and whistles in that room.
Yes. Feels like you're like in a 3D video game and so on. Yeah, it's so cool. That's what I love about it. Yeah.
What is your favorite feature on the Minx Control Venus, and why?
My favorite feature, I think, is the expanding nature of the sealant and how fast it absorbs. Again, the expanding nature, I feel like, helps with the bleeding and rebleeding issues, how fills that track. The track that we create with the venotomy, and then also how fast it absorbs is very important in case we need to go back soon, the patient, or we don't want the sealant being there for a long time to minimize infections and so on too. So I think these are the 2 biggest things.
Okay, perfect. Why do you think it's beneficial to use a closure device on veins versus manual compression?
Lots of benefits here. So I always say, you get, I think, again, lower risk of bleeding and rebleeding, and because you're not just dependent on formation of a blood clot, you're actually putting material in there that blocks that tract. You also get less bed rest time. So when we use the device, it's 2 hours. With manual compression, it's more like 4. Better patient experience. Imagine you're a patient getting a procedure and someone is pushing on your groin for like 20 minutes, and then you get less bruising and all that stuff. So there's so many positives towards using the device rather than manual compression. And then from my perspective as a physician, so that was the kind of patient perspective, patient outcomes, but also from my perspective as a physician, it helps with turnover times in the lab. We can kind of expedite patient cases because, again, if you're wasting an extra 10-20 minutes here and there between cases, that kind of adds up at the end of the procedure. So it really helps with turnover time and so on.
This seems to me like it must help your entire team out.
That's where the device really fits in. So from my perspective, again, it's about patient outcomes, it's about lab efficiency and safety. From the tech perspective, it's they are not holding as much time on the groins anymore, and it's a better experience for them. And then also for the prep recovery nurses, they're not seeing much, in terms of complications. They're sending the patients home on the same day. It's kind of a predictable, reliable device. So it's really helped the 3 of us be on the same page and kind of streamline the whole process from kind of, after the procedure to the patient going home. So yeah, it's been tremendously helpful.
Is there anything else that you can think of that you'd want to say about Cordis or?
Yeah, I think one thing I'd like to add is, in terms of closure devices and that space, I think Cordis has a wonderful team. Honestly, leadership down to, the reps that I work with every day. everyone clearly loves the company. Everyone works hard for their product. Everyone's very, very involved and very engaged with us. So I think that's something that really, really kind of stands up for Cordis, and make sure you keep it going. It's part of the company culture. So.